Hi, I'm Dr. Sandy Werner, and we're on our way to do a radial artery line with ultrasound guidance. Come along with me. Dr. Dan Haggerty will be performing this radial artery cannulation. He's positioning the machine so that the screen is in his direct line of sight and he doesn't have to turn his head while he's performing the procedure. He'll be using a linear, high-frequency transducer for this radial artery cannulation. The radial artery is identified with a transducer in short axis. It's placed on the arm just proximal to the wrist. The indicator is towards the patient's right side, and the patient's right side is seen on the left of the screen. To confirm the indicator placement, Dan is depressing the skin on the left side of the transducer and looking for the corresponding deformation of tissue on the left side of the ultrasound screen. In hypotensive or obese patients, it can be difficult to palpate a pulse, but if the patient has any blood pressure, the radial artery can usually be seen to pop with gentle transducer pressure. Notice the two veins adjacent to the artery being compressed completely with transducer compression. Color Doppler can also be used to help identify the artery. Dan will now anesthetize the skin and subcutaneous tissue just above the radial artery. He prepares the skin. He'll locate the artery with the ultrasound transducer. And inject a small amount of lidocaine into the subcutaneous tissues. Once the area is anesthetized, we'll go ahead and prep the patient and drape her in the usual sterile fashion. And now we need to prep the transducer. Dan is getting the sterile sleeve out of the kit, which contains a sleeve, sterile gel, and rubber bands that you can use to attach to secure the sleeve to the transducer. Meanwhile, I'm applying some gel to the transducer. Dan is rolling up the sleeve like a sock. I'm going to actually drop the transducer into the sleeve. Dan is staying sterile while I'm holding onto the cord. And he'll slide the sleeve up the transducer. Make sure his gel cushion is intact right on the transducer head. And then he'll secure it with a rubber band. He can then lay the transducer right across his sterile field. At this point, we're ready to cannulate the radial artery. Dan is going to put a small amount of gel, the sterile gel from the packet, onto the transducer. He'll then re-identify the radial artery. The transducer indicator is still towards the patient's right side. He's going to identify the artery in the middle of the ultrasound screen and make sure his transducer is right over the center of the artery. So the artery is centered in the screen. He can see it popping, and he'll identify exactly where he's going to insert the needle by pressing down gently with the capped needle. Once he's identified the artery, and it's in the center of the screen, the center of the transducer, he'll take the cap off the needle. And insert the needle just distal to the transducer. On the ultrasound screen, he'll watch the needle making its way to the artery. Tense the artery wall slightly. And using gentle pressure, pokes through into the artery. This radial catheter kit has a wire, and so he's advancing the wire into the artery. And at this point, he can remove the rest of the kit from the catheter and attach the catheter to the standard tubing for the radial artery kit. Now we've seen cannulation of the radial artery under ultrasound guidance. This technique can also be used on the femoral artery. As happened in our demonstration, just remember that if your needle is off center or you can't visualize it, you want to withdraw and start again. This technique is particularly good for obese patients and those who are very hypotensive.